Hello, my name is Victoria Nahum. In 2006, my stepson Josh, an otherwise healthy and adventurous skydiving instructor living in Colorado, experienced an accident that fractured his skull and broke his leg when he landed too hard on his final jump over Labor Day weekend. Because of these injuries, he was admitted to a nearby local hospital for care where during the course of his treatment, he caught a hospital-acquired infection and later died. But sadly, and most tragically, not from his original injuries. Our son died after an infection he developed during his medical care entered his cerebrospinal fluid, causing so much pressure to be put on his brain that it actually pushed part of it into his spinal cord. This infection, an unexpected result of his recovery, not only irreversibly damaged his spine, but in the end made him a ventilator-dependent quadriplegic, leaving him completely paralyzed with no movement whatsoever except for his facial expressions. Josh died 2 weeks after that from the severe physical damage done by the presence and impact of that accidental infection. He was 27. After he died, it became important to me to understand why he died. Why, when he was recovering so well, would he die from an infection? I wanted to know why these kinds of infection existed, and I wanted to know if there were ways that we could prevent them from happening to other people. What I found was disturbing because experts in infection prevention and control, those who know, told me that there was a great possibility that Josh's infection and death could have possibly been avoided. I'm here with you today to speak about avoiding these infections and your important role in the care of your patients, specifically how you can be the difference it will take to save your own patients from the prospect of potential sickness or death from hospital-acquired infections. To be clear, hospital-acquired infections are infections that patients can catch while receiving medical treatment for other things within a healthcare setting, like a hospital. These infections are also known as healthcare-associated infections or nosocomial infections. During a time of sickness or ill health, people's immune systems are usually not as strong as they are when they are healthy. And so it is all the more important reason to take care not to expose them to harmful bacteria. Unfortunately, bacteria exist in every healthcare setting and can be easily transmitted to patients by contact, usually with the hands of healthcare workers or even visitors. And so that's why it's up to hospitals and especially caregivers to do their best to keep these bacteria and the potential harm they can do far away from their patients, beginning with compulsive hand hygiene. The U.S. Centers for Disease Control and Prevention doctors tell me that more than 1.7 million American patients each year become infected, with more than 99,000 dying as a direct result of their infections. The number of annual infections equates to 3 people per minute, with more than 4,600 people every single day becoming contaminated by their care. And of those who are infected, approximately 271 people per day actually die from their infections. Healthcare-acquired infections are one of the top 10 leading causes of death in our country, according to the CDC, with more people dying of these infections in the U.S. than the sum of all those who die each year of AIDS, auto accidents, and breast cancer combined. These numbers represent a real danger and are an American healthcare tragedy because many, if not most, of these terrible infections are unnecessary and avoidable. So, as a caregiver, what can you do to help your patients stay safe? Well, you can begin with making sure that you always sanitize your hands. The CDC has estimated that if healthcare providers and visitors alike would only sanitize their hands prior to touching the patient or other objects in the room, they can effectively reduce bacterial infections by as much as 30 to 40%. In theory, full compliance with this procedure alone might save over 36,000 people per year. But really, unless you understand what that number represents, it's just another number, isn't it? In real life, here today, It means that you can actually save someone. You could save a real person with a real life, like my son Josh, someone's brother, someone's son, someone's mother, sister, or dear friend can live because of what you do. Wash your hands, save a life? Yes, that's quite possible. On October 22nd, 2006, our son died. He actually died, and because of that, my own life has changed forever, proving that the circumstance of Josh acquiring an infection has not only impacted his life, but also my own and the lives of our entire family. The fact that Josh died has now even impacted your life. Yours, because now I am here to remind you that what you do every day in your seemingly regular job is much, much more than you could ever think. What you do or don't do may easily be a matter of life and death for patients who depend on and trust you. With your commitment of good, safe care, many who you care for will live long, terrific lives, maybe even living well into the next century. I'd like to think that some of those who will live that long perhaps gain the benefit of longer life because of this message and the impact it has on you today and the way that you will deliver care tomorrow. Change one thing, change everything, it's true. I ask you that as a caregiver, you would never forget that your contribution to life is significant and how you carry out your role has far-reaching consequences for so many people, profoundly impacting patients and their families in ways that you can never know or fully understand for decades and centuries to come. I hope you believe this as I do, because if you truly believe this is so, I ask you to focus then on making your impact now with commitment and resolve, proud to stand apart as a noble champion of safe care. I ask you to remember this day and these few moments we've spent together, and to remember how truly you are the one who boldly stands in the gap for those who trust you to help make them well again. Thank you for your commitment and for your focused effort to be the change that changes everything.